Hi, and welcome back to the Midwife Moment. I'm Nicole with Tampa Bay Midwives, and today Courtney and Michelle couldn't be here because life, and we all know how that goes. So you just get my lovely face today. But today I'm going to talk to you about when the appropriate time is to start prenatal care, whether that's with us, with an OB, with another midwifery group, just usually what the best time is to start care. For us, we recommend having your first appointment around 10 to 12 weeks of pregnancy. And that's for multiple reasons. One is that we use Dopplers to listen to baby's heartbeat, and it's best heard with a Doppler starting around 10 weeks. It's not always the case. Sometimes babies are just hard to find and it takes a little bit longer, but usually around 10 weeks is our safe zone of when we can typically hear baby's heartbeat. It's also a good time to start care because most genetic testing you have to be at least 10 weeks for. And so the main test that a lot of people want is something called NIPT, or non-invasive pregnancy testing. And this screens for things like Down syndrome and Edwards syndrome and things like that. It can also tell you baby's gender, which a lot of people want to know. So like I said, you have to be at least 10 weeks for that test to start, which is why we recommend coming in around 10 weeks and not really any earlier. That's not to say you can't come in earlier, but there's just less things we can do for you at those really early visits. Another reason that we recommend starting care around 10 to 12 weeks is because if you are unsure about when you're due, or if you just want a chance to see baby with an ultrasound, we can write a requisition or a script for an early ultrasound so that we can best determine dates and you get a chance to see baby. Most dating scans are best done before 14 weeks of pregnancy, and that's because of the way they measure baby using ultrasound. It's more accurate when baby is smaller versus when you're later in pregnancy. The dating isn't quite as accurate because babies can grow at different rates at that point. But in early pregnancy, they all typically grow at the same rate. Those are just a few reasons why we recommend starting care in that late first trimester. Not every provider is going to say the same thing. Some may say you can come in later, some want to see you, as early as possible. You just have to find the right provider for you and make sure that you are getting that prenatal care at regular intervals. Which, speaking of, the typical schedule for prenatal care is you come in and are seen every 4 weeks until you're 28 weeks. When you're 28 weeks, then it goes to every 2 weeks until you're 36 weeks. And then from 36 weeks until the time you deliver, you come weekly. And so that's because in that third trimester of pregnancy, which starts around 28 weeks, there are more conditions and things that we are looking for and monitoring. We also always want to be certain that you're feeling baby move regularly, and it's just best to check in with you more often towards the end. Not to say that we don't care as much in the beginning of pregnancy, it's just there's not as much that we can do or offer you during that time. We love getting to know our clients and their families and any other kids that they already have. And so those visits in the last trimester are always super fun because we get to see you all the time and we really grow closer together during those last few weeks of pregnancy. Some people, if they've already had a baby before, they sometimes feel that it's not always necessary to start care right away because they know that there's not as much that we can do during those early months or weeks of pregnancy. While a lot of people do feel that way and they tend to delay the start of their prenatal care, that's not something that we recommend, only because it's best to get all of your testing done on a regular schedule, because there's initial labs that we do at your first visit. Obviously, there's the glucose challenge test around 28 weeks that we have to do. And then at 36 weeks is when GBS, or group beta strep, is screened for. And so making sure you have a care provider that is able to do those tests at the appropriate intervals is important so that you're not missing out on anything vital. It's also really important to have a provider earlier so that you can be either given a script for an anatomy scan around 20 weeks of pregnancy, or your OB or other provider can do it that day, because that anatomy scan is super important for us as providers to know what's going on with your baby, where your placenta is located, if there's any abnormalities that they're finding or any concerns that they're having. It's a really good time to get a baseline so that we have, the remaining roughly 20 weeks of pregnancy to keep monitoring and keeping an eye on things if there was anything that came up during that initial scan. So yeah, being sure to start care with a provider as soon as you know that you're pregnant, or within the first couple of months of knowing that you're pregnant, is really important and something that we highly recommend. Some people don't want that, and that is their choice. As midwives, we really strongly suggest coming into care around that 10 to 12 week mark. It's also best to get situated with a provider sooner rather than later, because a lot of places book up really fast, especially midwifery practices where there might be only 1 or 2 midwives in a practice. They have to limit their numbers so that they aren't overworked and stressed out and all of that. That's something for our own mental health, but they do fill up really fast. And so it's important to get in sooner rather than later so that you have a provider that can do all these tests for you and give you requisitions for ultrasounds and just be there to answer questions and concerns that you are having during pregnancy. Because the internet doesn't know everything and it can give false information. So it's important to see somebody who, went to school to learn all about all of this stuff. All right, well, that is all I have for you today. Feel free to follow us on social media. All of the links are located in the description below. If you are local, you can also reach out to us through our website if you are pregnant, and we would love to schedule a free consultation with you to discuss coming into care with us. So yeah, we hope to hear from you soon. Bye.